Hello, I'm Elaine Flint of Wellbeing Healthy Living Centre, and I'm the VOSCA advocate to the Health and Wellbeing Board. I attended my first meeting on the 19th of August, which was an interesting experience, 200 pages of documentation. So here are the highlights. It started with an interesting political statement about the privatisation of the NHS, a statement around the shortlisting of Virgin Care as one of the potential providers for the children's community health services. So that was an interesting debate, and of course it was around the requirement to abide with commissioning rules, so there was no real outcome for that, but it was good it was raised. One of the main items was around care home recommissioning at the end of a long piece of consultation. A really positive element coming out of it was a new Bristol standard to being imposed onto private care homes, which hopefully will drive up the standards of care. The danger is whether the market will be able to respond to it. Not much community sector involvement in that, but obviously some large charities involved. There were some interesting presentations, one from Health Watch, and I think the report from that is going to be appended to this video report. Also another report from the Healthy Living Pharmacy pilot. The key thing from the Health Watch, one of the actions I suppose from the Health Watch, was the ongoing discussions around the poor transport to Callington Road Hospital with the changes to the 36 bus, and point made that, you know, because it's a mental health hospital, there would be, you know, a different reaction if it was a general hospital and transport available, which I think is absolutely true. There is some recommissioning of sexual health services. This will impact on some VCS organisations who have current contracts. Again, I think the paper is going to be appended to it. The new service they hope to have in place for April 2017, a first round of consultation going on now between August and October, and then a second round actually on the specification between November and January 2016. So that's something for those organisations in that sector to need to watch out for. The absolute best bit of it was a presentation from the Bristol Youth Council for really dynamic young women. It was absolutely great, really engaging and interactive, talking about their priorities, of which a very strong priority around health and well-being, particularly around mental health of young people, how that can be supported through sort of school champions, and they're hoping to have a programme of events in 2016 to engage young people around positive mental health issues. So really, really exciting and really energetic. They're working with Off the Record closely, and I was able to link them to national programme Time to Change, which is run by Mind and Rethink, and which is running a more in-depth programme in Bristol, including a strand with schools, so hopefully that was useful for them. One of the things that came up, I think probably just from the minutes, but it's really important, is around the government cuts to public health and the impact on Bristol. What is being proposed and consulted on is probably a 6% in-year cut, which, given we're now in September, is a 6% cut in 6 months basically. And looking at the figures for Bristol, that means a £2 million cut this financial year in public health services. So we obviously wait to see what the impact is going to be, because public health funds a broad swathe of VCS organisations, as well as the services they provide directly. So I think that's something we need to keep a very close eye on. Another key programme is the Better Care programme. There wasn't much discussion about it at this August meeting, but there is going to be a full written report on the Better Care programme at the next meeting, which was on the 21st of October, so we shall wait and see what transpires from that. So I think those are the highlights from the August meeting, and look forward to the next one in October.